All right, it's End of Shift, and today I want to talk about the greatest privilege and responsibility that long-term care nurses have that you might not know about, and that's helping family navigate conversations about goals of care. In other healthcare settings, it's primarily led by the physician, but in long-term care, they often ask us to help out, right? Because we've spent weeks, months, even years with some of these residents and their families. And that doesn't mean we're making the decision or we're replacing the physician, but we're helping families understand through that trust relationship we've built what they're seeing, what the physician is recommending, and does it line up with what their loved one would want. And one of the biggest misconceptions is that opening the comfort care conversation means we're giving up. It absolutely does not. But we are tasked to make sure that the care we're providing matches what the resident would want. The greatest act of compassion sometimes isn't thinking, what else can we do? It's asking, what would the resident want us to do? Not easy conversations. By the time we're having them, we know the resident, the family, we've watched these changes, the harder recoveries. We're not walking into the story at the end because we've been there all along. So when the focus shifts from curing to comforting, our job doesn't become smaller, it becomes different. Because now we're protecting comfort and preserving dignity, supporting families through one of the hardest decisions they'll ever have to make, one of the hardest times they'll go through, reminding them that comfort isn't about giving up. Sometimes it's the most compassionate form of care we can provide. Every patient tells a story, and the last chapter is just as important as all the rest.